Let us start with spinal cord injury. This refers to an injury to the spinal cord that will now result in either a complete disruption or a partial disruption of the nerve tracts or the neurons of the spinal cord. Remember that the specific clinical manifestations of SCI would depend on which area of the spinal cord is affected by the injury. For example, if the affected vertebrae is in the lumbar area, expect that the signs and symptoms will mainly relate to those below it. Example would be paraplegia or paralysis of the lower extremities. We may also have urinary retention because of paralysis of the organs under the lumbar vertebrae. If, however, the affectation is on the cervical vertebrae, expect that the clinical manifestations would refer to anything below it. So example would be quadriplegia or paralysis of all four extremities. And we also have here problems in breathing, problems with intestinal function, urinary function. So these are examples of these ones. What else? The most frequently affected vertebrae in SCI we have here T5, 6, and 7. We also have T12 and we have L1. What are the major causes, or what are usually the stories behind SCIs? Usually they are caused by car accidents, falls, and sports injuries. Let's go to risk factors. As to risk factors, as to gender naman, the male gender is more prone compared to the female gender because of their vulnerability to certain activities. Examples are males are more prone to riding motorcycles compared to women. So in our case, you would notice that mostly those with MVA's history of motor vehicular accidents due to motorcycles are mainly men. High-risk lifestyle activities, for example, you engage in trails, you engage in trekking, hiking, active in sports such as boxing, basketball. As to age naman, this would usually cover those in their teenage years up to their early 20s. So in this case, what happens? They are more vulnerable, or they have the preference to engage in high-risk activities. Mas daring yung mga activities na ginagawa ng mga teenagers up until their 20s. Alcohol and drug abuse may also relate to spinal cord injury. Now let's start with the causes of SCI. Again, we mentioned it's mainly due to car accidents, falls, and we have here sports injuries. So pathophysiology, of course, it starts with an injury, depende kung anong injury yan. And then because of that injury to the spinal cord, this would lead to hemorrhage of specific areas in the spinal cord. Because of the hemorrhage, of course, this will lead to edema. And when edema occurs, there is already problem with the microcirculation of the spinal cord. Because of that, because of the impairment of the microcirculation of the spinal cord due to edema, this will lead to poor perfusion and development of ischemia. The ischemia will now lead to oxygen tension in the tissue will become decreased. So nagkakaroon lalo ng decreased perfusion of oxygen into the spinal cord. Because of decreased oxygenation of the spinal cord, this will lead to necrosis. Yan. Because of necrosis, namamatay yung mismong neurons, mismong nerves, mismong cells in the spinal cord. This will lead to loss of function on the areas below the lesion. So below the lesion kasi nga wala nang dumadaloy na electrical impulses. Hindi na gumagana yung spinal cord. So this will lead to different complications. One would be spinal shock. This would have an effect where there is decrease in reflexes, nagkakaroon ng flaccid paralysis, so nag-a-atrophy yung specific extremities or parts of the body that is affected by the SCI. It can also lead to neurogenic shock or sudden disruption of the sympathetic nervous system, which can lead to the following clinical manifestations. Hypotension. We also have here bradycardia, hypothermia, and we have warm and dry extremities. This may also lead to peripheral vasodilation that will lead to venous pooling. Nagkakaroon ng accumulation of blood into certain areas, and because of that, this could lead to decreased cardiac output kasi konti lang ang nakakaakyat back to the heart. Clinical manifestations as to the effect of spinal cord injury, this may lead to paraplegia, quadriplegia, or spinal shock. In paraplegia, remember, ang affected areas would be the lower extremities. Quadriplegia, all extremities. So you would expect that the spinal cord injury is at the level of the cervical vertebrae. Pag paraplegia, usually it's either lumbar or thoracic. And we also have spinal shock. This is a complication of spinal cord injury. We also have here hemiplegia. Ang hemiplegia naman is a vertical affectation of the one side of the body. So it's either right side of the body and left side of the body, or ipsilateral. Same side of the body. Pag left side ang affected, lahat ng left side part ng katawan. Remember also that the signs and symptoms of patients with SCI will depend on two factors. So we have here the location of the injury, kung saan affected. Lumbar ba yan, thoracic ba yan, or cervical area. What else? We also have, or it will also depend on the severity of the injury. Paano pag necrosis already, there is total destruction or damage to the spinal cord? Of course, mas magiging permanent yung effect niya. For some naman, pag ischemic effect lang siya or transient effect lang on the spinal cord, the signs and symptoms will not be as severe. We have here examples: pain or an intense stinging sensation, loss of movement, loss of sensation, loss of bowel control, exaggerated reflexes, change in sexual functioning, and difficulties in breathing. What will be emergency signs and symptoms? So this will alert you that you have to immediately report this to the physician, and we have to address the problem immediately. So we have here fading in and out of consciousness. So meron ng central affectation or central nervous system na ang affected dito. Extreme back pain or pressure in the neck, head, or back. Weakness, numbness, or tingling or loss of sensation in the hands, fingers, feet, or toes. Loss of bladder or bowel control. Difficulty with balance and walking, impaired breathing after injury, and oddly positioned or twisted neck or back. So we have here again the levels of injury and extent of paralysis. Pag cervical ang affectation natin, quadriplegia. If there is lower cervical area, it's still quadriplegia. Pag thoracic naman, you will expect here paraplegia. So usually hindi affected ang upper extremities. Pag lumbar, also paraplegia. We will also have to remember that spinal cord injury are classified according to the cause of the injury, the level of the injury, and the degree of disruption. Kung ano yung nagkakos, ano yung affected na areas, and what will be the severity of the injury. So we have here what we call your central cord syndrome, where the central aspect of the spinal cord is affected. Kaya siya central cord symptom. So in this case, this would have an effect on motor deficits, usually affecting upper extremities than lower extremities. So you'd usually notice pag central cord syndrome, upper extremities ang pinaka-main na target niya. Although sometimes it can also affect the lower extremities. However, as to the severity of the injury or severity of the disruption, usually upper extremities. Cause, injury or edema of the central cord, usually of the cervical area. Another type of spinal cord injury would be anterior cord syndrome. In your anterior cord syndrome, the anterior aspect of the spinal cord is affected. In this case, this would now lead to paraplegia or affectations in the lower extremities. We also have here another example would be your Brown Sequard syndrome. In Brown Sequard syndrome or your lateral cord syndrome, the lateral aspect, either right or left side of the spinal cord is affected. So in this case, you would expect that same side of the body is affected. So for example, we have here the right side only or the left side only. Mechanisms of injury. Mechanism of injury would refer to the forces that will now cause the injury. Examples of the mechanisms of injury: hyperflexion or overflexion of the neck, for example. So in this case, pag nagkaroon ng motor vehicular accident, walang protective gear or walang seatbelt yung pasyente natin, mag-overflex yung neck ng pasyente. This could affect or this could injure the spinal cord. Hyperextension naman is the head would start moving back. The head starts moving back, magkakaroon ng hyperextension. What else? This could lead to, ayan, head snaps back or whiplash injury resulting to tear to anterior longitudinal ligaments. Distraction naman, stretch injury of vertebral column resulting to cord rupture. So in this case, nagkakaroon ng overstretching of the spinal cord. Axial loading or vertical compression, falls where individual land on his head, buttocks, or feet. So in this case, head, buttock, or feet ang usually damaged. Penetrating trauma when there is a contusion or transection. So for example, we have here shockwave from electricity. Diagnostic tests or laboratory tests done to determine possibilities of SCI. Number one would be history and physical examination. It's very important to know the history of the patient. What did the patient do or what happened prior to the injury to the patient? X-rays will also determine any affectations in different areas of the vertebrae. MRI may be ordered again as a further workup if a ligamentous injury is suspected. So since significant spinal cord damage may exist even in the absence of bony injury. So again, kung wala namang nakitang injury to the vertebra or to the bones of the patient, however, there are still clinical manifestations that would suggest SCI, that's the time they're going to order MRI. Pero ang mga initial kasi na binibigay nila na diagnostic tests are X-rays and CT scan. We also have here your electromyography or your electromyography. So in this case, you have it here. They're going to determine yung activity ng muscles. If again, there is problem with the muscle contraction of the patient, this would mean there is possibilities of spinal cord affectation. We also have what we call your continuous electrocardiographic monitoring. So in this case, it's very important to note the following. Saan na yun? We have what we call your bradycardia. So ECG is still done. Bradycardia and asystole. These two clinical manifestations or these two symptoms can now cause or this could now indicate spinal injury if there is bradycardia and asystole. Complications. As to complications, of course, number one is paralysis. We mentioned it's either quadriplegia, paraplegia, or hemiplegia. Autonomic dysreflection naman, this refers to a hypertensive crisis or shooting up of the blood pressure of the patient due to noxious stimuli. This would happen, example, for overdistension of the bladder in the case of urinary retention brought about by paraplegia. So dahil nga may paralysis dun sa may lower extremities ng pasyente, this could affect the bladder also. Hindi na-stimulate yung bladder na mag-contract para iihi ang pasyente because of the paralysis. And because of that, mas nagdi-distend lang yung bladder, this can trigger a hypertensive crisis. We call that autonomic dysreflexia. Neurogenic shock naman or spinal shock. In this case, there is impairment of the autonomic function that could last for 2 days up to 3 weeks. What are clinical manifestations? Hypotension, bradycardia, and hypothermia. Contractures, this is related mainly to the lack of exercise or lack of movement in certain extremities. If hindi nagkakaroon ng passive ROM or exercises ang pasyente, this could lead to contractures just like your stroke. Muscle atrophy, of course, muscles that are not being used will start to decay. They will start to get smaller. Pressure ulcers, again, due to immobility brought about by paralysis. Magkakaroon ng pressure ulcers kung hindi sila nalalag roll or hindi sila namumove to different positions every 2 hours or every hour. Paralytic ileus naman, from the word paralytic, hindi na gumagalaw, intestines. In this case, insert NGT to decompress gastric content. If the patient has GI bleeding, you're going to give them H2 blockers. Examples are Tagamet or Zantac. Suppositories may also be indicated for patients with constipation, brought about by paralysis again. If these are not addressed immediately, especially in terms of breathing and cardiac output of the patient, this could lead to death. Okay, next. Let's go to pharmacology, so medications used for SCI. Take note that when you're going to give glucocorticoids for patients with SCI, usually we give them Decadron or methylprednisolone sodium succinate. So this has to be administered within 8 hours after injury. Take note, the golden period is 8 hours. Dapat binigayan agad within 8 hours after injury. And make sure to monitor blood glucose levels kasi pwedeng mag-shoot up yan. Mannitol is also used as an osmotic diuretic that is usually given IV bolus. Malaking kanyan, bottle of mannitol. And then you're going to instill it in the patient via IV. This is to reduce edema, especially in cerebral edema. Cerebral or edema in the brain. Histamine or H2 receptor antagonists, they will now help by decreasing or neutralizing the effect of steroid that increases gastric secretions. So again, remember, steroids or glucocorticoids are given to these patients. One of their side effects would be increasing gastric secretions. How can we counter increased gastric secretions? We give them H2 blockers. Muscle relaxants also, methocarbamol, calcium supplements to prevent bone decay or anong tawag natin doon? Take note that immobility has a tendency to, when there is prolonged immobility of the patient or masyado silang naka-bed rest,